this facing you. Okay, see how it's opening here? You always want that facing you, because inevitably what'll happen, you'll be picking these up, putting them down, and you'll get the cords tangled up and everything. So if it's gonna fall, it's gonna fall on you. It's not gonna fall that way, because that's a nightmare if that happens. I mean, it's not, you're out of the class, but you know, you gotta deglove, do all that other noise, and then have to come back. So always have that facing you all the time. All right, dude. There you go. All right. You're recording. Where's your cheeks? Let me use your cheeks.
Yeah, absolutely.
Okay. All right. So it seems like a lot, all these little steps, but it'll be fine. Okay. So the first part of the assessment, you have your armamentarium up on top. So you want to make sure that you have your gauze, your dry angles. Is everyone familiar with the dry angles?
No.
Okay. So these are used because this is moisture control. So we're trying to keep everything nice and dry in that patient's mouth. So anything that we can use, any absorbent, this is considered an absorbent. And this one is designed to cover the Stenson duct, which is your salivary gland, which is, you know, near your cheek. So on a real person, this would stick right to the cheek, okay? So you have your shiny side, which is going to be facing out, and then this is going to go up against the tissue. Okay, so this is a triangle, and they have different sizes. So you'll have your triangle, you have your floss, the patient napkin, basic setup, which is your Explorer, not really an Explorer, but it'll do, mirror, and then the cotton pliers. You have cotton rolls. You have the disposables. You have your HVE tip, you have your saliva ejector, you have your air water tip, and then he'll have the safety glasses, and then the bite block. And the reason you have the dental floss is to ligate the bite block. Okay. Anytime that you're going to be putting anything in the patient's mouth, bite block, a dental dam clamp, anything like that, you need to ligate it in case it gets dislodged or it becomes loose in the treatment and the patient doesn't swallow it. So you just fish it out. Okay, so this is part of your assessment also, is ligating the bite block. Okay, and these are, everything's over there on the cart. That's where all the stuff is, except for the instruments, obviously. But we'll get to that. Okay, so the first part of the assessment is retraction. So what this does is just teaches you what you can use for retraction. Okay, the mouth mirror can retract the upper lip, the lower lip, and the tongue. So the first thing that you're going to be using is use retraction technique for A, use the mouth mirror to retract the upper lip. The easiest thing to do, again, this is Fletcher, so he is what he is, but on a patient, you don't want to just like jam it up in there like that to retract. Always start on the cheek and, you know, kind of rub it up against the cheek, and that way you'll get a little bit of saliva on the mirror and it'll slide right up in there. And that way you're not irritating or you're not, you know, causing any trauma to the tissue. So you, for a real person, so get used to like coming in like this and retracting. And depending on if you're left-handed or right-handed, now keep in mind that the doctor's going to be sitting here, so you don't want to be in his way like this if he's sitting there. So the easiest thing to do is come around this way and retract that upper lip. And then you're going to use the mouth mirror to retract the lower lip. So again, just again use that tissue to come around like this, because you don't want to jam it right in there. So just start on the cheek. If you do an upper, retract up. You're on the lower, retract low. Use the mouth mirror to retract the cheek on the left side. So you, and then you want to, and then use the mouth mirror to retract the tongue on the client's right. You're going to be using this to retract that tongue. The tongue is super strong muscle. The patient's numb, and so they don't know what they're doing. So all you're going to do is you're just going to retract that tongue, just like that. Okay? And then use your fingers with wet gauze to retract the upper lip. Anytime that you put in any type of absorbent in the mouth, if you're putting it in, taking it out, it has to be wet before you take it out. So since you're using this for retraction, you're going to go ahead and you're just going to wet it a little bit. because you're going to be using to retract the tissue. So again, start with that cheek, come up, and just you're grabbing the cheek, the lip, and you're pulling it out. He doesn't have any lips, but we're going to pretend he does. And then use the fingers with the wet gauze to retract the lower lip. Same thing. It's easier if you just come in the cheek and slide down and then retract. You're going to be pinching that, I mean, you know, you don't want to hurt them, but that's the easiest way to do it. And then that's it. Then you're going to pick up the HVE in your right hand. So see how, like, you know, when you're lifting them up, these will like flop out or whatever. So that's why you always want it facing you. So pick up the HVE in your right hand and turn it on to use it, and then use it to retract the cheek on the client's left side. I want you guys to get in the habit of having these two always in your hands. Okay, this is chips and dip. Okay, these two go together. Because what you do is, I don't want you, see how this is a beveled edge and the tip is here? This is super sharp. It can cut the patient's tissue. So you want to be able to place it, you know, not just like jam it in there. So the air water tip is good because you can use it to retract and then get into a good position and then come out with it. Okay, and the patient will appreciate you, trust me. So pick up the HVE in your right hand, turn it on to use it to retract the cheek on the patient's left side. Again, you don't want to turn this on until you have this in the patient's mouth. Okay, so because you're using it for retraction, you're going to have it in your palm thumb grasp. Anytime that you're using the HVE for retraction, this is, okay? So you're going to retract, you're going to come on in, you're going to, see how that twists around like that? You're going to turn it on, and you're retracting that cheek, okay? Leaving the HVE on the left side, use the air water syringe to retract the cheek on the lower left. So that's all you're doing, like that. Keeping the air water syringe in your left hand, use the HVE to retract the tongue on the right side. This is where you're going to use this, because again, if you come on in and you'll, obviously with Flesher, it's a little bit different, but I want you guys to get into that same motion. So with a patient, you're not going to be able to just come right in and retract that tongue, because what's going to happen is you're going to be suctioning up the tongue. So the best thing to do, again, use this to retract first so you can place this where you want it. So you're going to retract with the air water syringe tip, and then you're going to come in. Again, you're retracting, so you're going to come in, turn it on. We're going to have to find us a good air water that's not twisting around. Okay. And then you're going to, once you get the tongue retracted, then you come in with the HVE and place it in. Okay? And then remove the HVE and turn it off. Okay, so that's the first part. That's the demonstration for using with retraction. All right, so now we're on page 30. Number 2, use the bite block. Okay, so you have your bite block. You're going to place the air water syringe in your right hand, because your bite block is going in your left hand. With the left hand, place the bite block in the mouth and remove. So you're using this to retract. So if we're going to be placing it on the left side, again, you want to just retract so you can see what you're doing. Place the bite block and then leave it at that. That's it. And then you're going to remove it. Again, you're going to retract, have the patient open, take it out. Okay. Right, that was the easy one. Now, number 3, use the HVE for suctioning when the dentist is working on an individual tooth. So, what the perfect position for the HVE is to be one tooth posterior of the tooth you're working on. Because gravity is going to be forcing that water back to the patient's back of the throat, so you always want to be behind that tooth that the doctor is working on, parallel, so the beveled edge is going to be parallel to the tooth. Here, I use the tooth up on top. So it's going to be parallel to the tooth. So if we're working on tooth number 14, I'm going to have this back here by 15. The bevel edge is going to be facing back toward the patient's mouth. It's going to be parallel to that tooth, and you're not touching any tissue. Okay, don't be resting this bevel edge on the tissue because you'll cut the tissue. It's easy. Okay, so let's go back to the beginning. So using the HVE for suctioning, and the dentist is working on an individual tooth. I'll give you a tooth number. For your assessment, I'll be, 19, 14, 30, number 3. I'll give you a tooth. So I want to see where you're positioning this, how you're positioning it. All right? So hold the HVE control in the right hand, always using the palm-thumb grasp when retracting tissue. And then you're going to hold the HVE control using the pen grasp, okay? So when you're using retraction, which is going to be upper left, lower right, you'll be retracting. The only time you'll have the pen grasp is when you're in the upper right, because you don't have anything to retract. You're just right here, okay? Or if you're in anterior, upper anterior, okay? But pen grasp is the only time you use the pen grasp is in your upper right. Okay, so hold the HVE control in the right hand, always using the palm-thumb grasp when retracting the tissue. Hold the HVE control using the pen grasp. Open the control valve. Place the HVE to clear the maxillary right area. So maxillary right is the pen grasp. Okay, so that's it right there. The HVE, the bevel edge, is parallel to the tooth, it's pointed towards the back, and it's not touching the tissue. Okay? Place the HVE to clear the maxillary left area. So again, you're going to retract, palm-thumb grasp. You're going to place it in the back. It's going to be parallel to the tooth, and that beveled edge pointing back towards the back of the throat, not touching the tissue. Place the HVE to clear the mandibular left area. So now you're going to come down. So again, use this to retract so you can place it where it needs to be placed and come on out. Same thing. Parallel to the tooth, pointed toward the back, not on the tissue. Place the HVE to clear the mandibular right area. This is the one that most students struggle because of the tongue. So again, use the air water tip. You're going to retract the tongue before you place that HVE. And again, you're going to place it parallel to the tooth. That's the pointed edge back, and it's not on the tissue. Okay? So now I'm going to go ahead for number 4, air water syringe. So I'm going to give you a tooth number. Okay? You're going to rinse and dry a mandibular tooth using the water, the air and water, and then just the air. So when you have the air water together, you hit both buttons at the same time. It's giving it like a pressure wash. Okay, so you have the water by itself, air, water, pushing them both together, and then just the air to dry the tooth. If I tell you to just dry a tooth, and you've already used this for rinsing, make sure outside of the patient's mouth, you want to clear that line. Because if I'm asking you to dry a tooth, and we're getting ready to bond, we've just got done etching, and you're getting ready to bond, you have to keep that tooth dry. So if you go to dry it, and if this has been used, there's still water in the line. When you push that air button, water's going to come out, a little bit of water. So then you have to re-isolate, re-etch, do everything all over again. So always make sure if you're just drying a tooth, you're clearing the line first outside. You can do whatever you want to with it, okay? But you're just going to clear that line. So rinse and dry. So number 4, air water syringe. Rinse and dry a mandibular tooth using the water, the air and water together, and then the air. And then I'm going to have you rinse and dry a maxillary tooth, and then I'm going to have you clear the mouth mirror. So the first thing we're going to do is do a lower tooth. So I'll have you do tooth number 19. So I want to see where you're going to be placing the HVE. If I give you number 19, you need to pull, retract, come on in, palm thumb grasp. Okay, if we're working on 19, you're going to place that on 18. Okay, it's going to be parallel to 18, but not touching the tissue. And I'm going to have you go ahead and water for 19, air and water, and then dry it. Okay? all while you're making sure that you're keeping everything nice and dry. Now, honestly, I don't know where the water is going on him. But when you're working on a real person, and you will be for your assessment, I'm also going to be keeping track of making sure that there's no pooling water in the back of your patient's throat. You need to be keeping that in mind too. Well, she's still she's checking on it. Ideally, yes, you want to do a real person, because he's great, but there's a learning curve you have to do, especially with a real person. So that was 19. So now I'm going to have you rinse and dry a maxillary tooth. So I'll do tooth number 3. So that means that this is going to be parallel to number 2 in the back, parallel to that tooth. You're going to rinse number 3, spare water, and then dry it. And yes, you're going to have to come down and clear the throat. So the water's going down there, it's pooling down here. So in addition to keeping this dry while we're rinsing that tooth, you're going to have to come down. If there's any pooling water, you need to get in the habit of making sure that you're clearing that out. Because you don't want the patient to choke, have to sit up, everything's contaminated now. So you're trying to keep everything nice and neat. Okay, so now we're going to clear the mouth mirror. So you will be sitting here. I'm going to come around. So Larry, you're going to be me, okay? So all you have to do is just hold the mouth mirror here. So we are working on lingual.
Should I wear gloves?
No, he's fine. So if we're working on tooth number 8, on the lingual of tooth number 8, the patient's breathing, you have, you know, you're going to fog up the mirror, so you're going to have to keep that mirror clean. This is your indirect vision right now, so you have to keep that mirror as clean as possible, because that's the only way that doctor can see that lingual aspect of that tooth. So if they're prepping the tooth, then you have debris on the mirror, you have water on the mirror from the handpiece and everything, so you have to, that's one of, you know, you're going to have to keep that mirror clean so he can see what he's doing. So I'm going to have you clear the mirror. So how are you going to clear the mirror? Again, you'll have it in the pen grass, and I'm just going to have you rinse it with some water, and then we're going to dry it with the air. And I just want you to show me where this is. This is going to be right here. Not in the doctor's way, not here. It's going to be over here, so he can still see what he's doing. And anything that I'm rinsing off the mirror, hopefully, you know, most of this will be catching it, and then you'll dry it. Okay? And then again, coming back and making sure that they're not choking on anything. Okay, so that's how you clean the mirror. And then sometimes, I mean, you may have like a 2x2 or something like that to wipe it clean or something. He'll just, whatever. But for this assessment, it's just the air water. Okay? That's how you clear the mirror. All right. Now the saliva ejector, another easy breezy. So you have the saliva ejector. This will be straight. So you're going to shape the saliva ejector. All you have to do to shape a saliva ejector is just bend the tip, just like this. Okay? You don't have to mangle it all up. Just the tip. Because all you're doing is you just, you know, this is just in case you just, you know, a little bit of water here, a little bit of water there. You know, it's not like a full bore pressure washer where this guy is concerned. This is great just to clear, you know, little parts where that's accumulating. It's a lot more gentler on the patient. Okay? Adjust the flow, place in the patient's mouth, like that. Okay, so that's it for the saliva ejector. Now we're going to go into the absorbents, number 6. Place a dry angle over the Stenton duct. Again, this is where I really hope that we do get to work on a patient, because this will not stick on his cheek. Actually, do me a favor. Can you get me a little piece of Scotch tape? Because I want to tape this on the inside of his mouth. Because I want to show you guys how to remove it. Whenever you're taking anything cotton, any absorbent out of the patient's mouth, you have to make sure that it's wet before you take it out. Because if it's dry and you try to take it out, you're going to tear the tissue. So the same thing with this. Oh, yeah. Thank you. Okay. So on a normal person, this is going to come in, you're going to place it, and it's going to stick, hopefully. Okay, good. Nobody breathe. It's sticking. So that's where it's going to go, though. That's where it's going to be located, on the patient. And if you guys are working on each other, you're going to place it right here as well. Okay, so you place the dry angle over the Stenton duct. Position the cotton rolls for the maxillary left posterior, okay, So you can use cotton pliers if you want, or you can use your fingers. I don't care. But again, what makes it easy, and you can use your finger if you want to retract, and then pull it up there. And hopefully it'll stay up there. Another thing that'll fall down too. But anyways, so you're going to just place it on up there, okay? Dry the tooth with short puffs of air. Again, so you're just drying the tooth, so you can make sure that you clear the air, clear the water from your thing. And I'll do same thing. I'll do like number 14. So we're just going to dry it. Dry tooth number 14. Okay? And then now we're going to remove all the absorbents. Use water. That's what it says. So for the cotton roll, which, there it is. If it was still up here, you would, I'll hold it up here. Okay. I'm glad you're taping this. Okay, so if it was still up there, what you're going to do is, what I do to remove them, is I just take the water and just go right there on that tip, and then come around and get the tip behind the cotton roll and wet it, and then you can take it out. For the dry angle, what you want to do is you want to just wet the tip right here, get that wet, 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 and then use your tip of the air water to go up against that sheet with the water on, and you can remove it that way. This thing should be super wet when you bring it out, okay? Because again, if it's dry, if any of that's dry, so if you take your tip and slowly work it between the dry angle and the cheek, then you will completely remove it safely, and it'll be all wet. That's the easiest way of doing it. You can get the pop pops. Okay. And then whenever you take out any absorbents, usually there's debris behind it. You know, they've been up there during the whole prep, so they'll have, you know, existing tooth, or, you know, if there was a restoration in the tooth already, or if there was a prep or anything. So there's going to be some debris in that mouth. So whenever you take out absorbents from a patient, always, always, always get in the habit of doing a limited rinsing technique to just make sure you have a nice clean area now. So when you're doing a limited rinsing technique, that means usually if it's limited, it's just a quadrant. You're just going to go from the posterior to the midline and back, okay? Posterior to the midline and back. Or if you're working on the anterior, whatever. But you don't have to do a full mouth rinse, okay? Unless you have debris everywhere. But if it's just a limited rinse, so what you're going to do is you're going to come in. If we're going to do a limited rinse for, if we are working on number 14, then you're going to retract. Since it's retraction, it's in that palm grasp. Come in, place it, and it's going to be a limited rinse. It's going to be air and water together, okay? So you can come in, up to the midline and back. You're not moving this, okay? Because the water is going back to the back of the throat. You're only moving this, okay? This guy here has to stay here so that he can collect all that water that's coming straight back to the throat. Does that make sense? Okay? So don't worry about moving him so much, but move this one. So you're just going to do the air water syringe. You come all the way back and come back, getting back in that throat, and then you dry it off. And then just come back and dry everything off. Okay? If you're going to do a lower, same thing. Retract, place this where it needs to be going, and then come all the way up to the front, and then all the way back, getting the water in the back of the throat, coming up, coming back, getting the water in the back of the throat. And when I'm coming back in with the air water syringe, with the HVE tip, I'm retracting so I can get a better view, okay? Because if not, that's when you're going to be sucking tissue. Always use this to retract as much as you can if you are going to be moving this guy, okay? Right. How are we doing? Okay. So that was your limited rinsing technique. So complete, number 7, complete mouth rinsing technique, if time, or when waiting for an instructor. So place the HVE tip in the posterior or the right side of the mouth. Begin rinsing in the maxillary right midline. Clear the accumulated fluid from the mouth of the floor. Continue to clear the mandibular right. And you can have your patient, if this was a real person, have them look at you, have them look away, you know. Just say, can you look at me? If you can't see, you know, they're looking this way, just have them turn their head so you can see better, you know? Place the HV tip on the facial side of the left quadrant and posterior mouth. Repeat same steps for mandibular left. What does that mean? Basically, you're getting ready to do a full mouth rinse, okay? And the pattern that they're keeping you at is you're going to start in the upper right, okay? So, again, pen grasp, because you're not retracting. Pen grasp, so you're going to go back, the midline, and back. Retract, place it in the back. Same thing you just did. Back, midline, back. Retract, place this, back, midline, back. Now you're doing that lower right. Retract the tongue with your air water syringe. Place this where it needs to be. Rinse, boom, boom. Okay? You are not moving this, you know, except to go from quadrant to quadrant. You're not going to be following this guy because that's where you're going to be sucking tissue. Just keep him in the back of the throat because that's where the water is going. Okay? This guy's the one you're going to run. So, let me show you. Pen grasp up to the midline and back, and then do the air. Okay? Retract, place, up to the midline, back, retract, get the water out, place, up to the midline, back, retract, get that extra water, retract the tongue if you can, place, retracting, back to the midline, I hate this tip. Okay? I'll get all out. That's a full mouth rinse. Okay? Now, if you were just doing an anterior rinse, you know, then you would just keep it here. Right up the nose. Sorry, dude. All right. So that is your assessment. What I will be looking for during all of this is for you to avoid suctioning tissue, okay? And you'll hear it. It'll be, if you're walking by it, everyone will be, you know, you're like suctioning tissue. Place the bevel one tooth posterior to the tooth being worked on. Okay, so if I give you a tooth number, I'm going to be watching to see where you're placing this. Okay, so it needs to be one tooth posterior to the tooth that we're working on. And making sure that that beveled edge is parallel to that tooth. Okay, because if it's up like this, you're not going to be suctioning up the water. You know, if it's like this, that water's going to go straight. That's why you have to keep it like this. You have to keep it facing that tooth, looking at the tooth. Avoid resting the bevel on the tissue, keeping the bevel parallel to the tooth, keeping the throat clear of water, and then of course following the septic technique. So
what if you spray water up their nose?
Sorry, dude. You know, you usually only make that mistake once, so you won't. You won't. I have faith in you. You will not do it. All right. So that's it. So that's your assessment right there. Okay. Huh?